Please, can you, even before COVID-19, majority of the people in the West African region and Africa at large live below the poverty line, where some people have they live below $1 per day, as it said. What role should the government and civil societies play to prevent a mass casualty should the tide rises? And what can the vulnerable people in our society do to get by this challenging period? Are there authorities they can reach out to? Please, can you provide a perspective for us on this?
Thank you very much. So in terms of talking about the vulnerable and the poor, we are looking at two distinct set of people. When we are, and this is me trying to do a contextualization of the categories of people that we are talking about. First, the vulnerable, and secondly, the poor. When we are talking about the vulnerable, we are talking about a population of people who, as a result of existing inequalities, would be disproportionately affected as a result of the COVID pandemic first, the fact that there is a virus that is ravaging the society on one hand, and would also be affected by the measures or the actions that are being taken to curb the impact of COVID-19 or to flatten the curve, as we have been saying. So such kind of actions like social distancing, washing your hands, and all of those things. So when we talk about vulnerable people, we are talking about that group of people who, would either to have been affected generally because of existing inequalities. And here we are talking about women and girls. We are talking about the disabled. We are talking about older women. We are talking about older people. We are also talking about those that are homeless. We are talking about those that are internally displaced persons, not just in the Northeast, but also in places of conflict and crisis across Nigeria. We are also talking about people with pre-existing medical conditions. These are vulnerable groups. For instance, people living with HIV/AIDS, people with chronic heart conditions, people with diabetes, and all those kind of medical conditions. So this group of people are considered to be vulnerable, not because of COVID-19, but because prior to COVID-19, they have existing issues that affect them and place them, on different scale as it relates to equality in Nigeria. The second category of people that we are talking about are those that we say are poor. And when we say people are poor, we are talking about being economically disadvantaged. Nigeria currently does not have a measure to say these are the people that are considered poor. We don't have an official measure or yardstick. What we usually do is to say those living below the poverty line. And the poverty line we have set to be $1 per day. And so when we look at $1 in today's Nigeria, we're looking at about $350, $360. So those who live below that and who live on that, we consider them to be poor. And those who live below that, we consider them to be critically poor. Now, in terms of how this can affect them, this COVID-19 can affect them, we need to look at it first from the fact that this group of people are first vulnerable. And we also need to look at it from the fact that this group of people are poor. Two categories of people. But let's not also forget the fact that these two identities can also intersect, creating what we call intersectionality, where, for instance, somebody living with HIV/AIDS may also be poor, vulnerability and poverty, or somebody that is homeless before COVID-19, and we've now said social distancing, those stand outside. The person is vulnerable and the person is poor. So we need to, in our responses or in our definition of these people, be able to understand that there can be intersectional effect on these groups of people. Now, the kind of effect that we are looking at is first the effect on their economic life. Most of these vulnerable and poor people, or let me focus a bit on the poor people. We're talking about the woman, for instance, that sells akara by the side of the road, whose daily profit is maybe 1,000 naira. And then as a result, this person is unable to now carry out that economic activity and thus cannot make that income and thus cannot feed his or her family. So we look at that kind of economic impact and we see how the pepper seller, the fish seller, the akara seller, those we consider to live below the poverty line would be hugely affected economically. We also look at the difficulty of adhering to the measures that have been put in place, the safety measures, the hygiene protocols that have been put in place. Let me shock you that as of 2019, over 57 million people do not have access to safe water in Nigeria. Yet a pandemic has forced us to wash our hands every 10 minutes or every 30 minutes. There are some people who just do not have that water to wash their hands. So we look at how, for instance, the aspect of hygiene and sanitation. We have over 130 million Nigerians who do not have access to sanitation. So we look at how these groups of people are affected economically, and then they are also, the impact on them is also how to make sure they do not contract this virus because they have difficulty adhering to some of these issues. Now, the broader effect on the vulnerable and poor, we're looking at the fact that it increases suffering. And that is because they do not have access to their economic life. Secondly, there has been increase in the spate of gender-based violence in Nigeria. Unfortunately, we do not keep data, so we don't have exactly what percentage. But NAPTIP, we were in a meeting with NAPTIP yesterday, an e-meeting, and some other responders in Nigeria. There's been increase in the number of men beating their wives, in the number of wives slapping their husbands. People are frustrated, people are angry, people are afraid. And we can see how that is also affecting women in their homes and gender-based violence. There's also lack of access to medical facilities. Imagine a vulnerable person that is deaf and dumb and has symptoms of COVID-19. How is that person supposed to communicate the symptoms or get the kind of help he or she is supposed to get? And that is because prior to COVID-19, we do not have measures in place that takes care adequately of persons living with disability. So these people are also affected as a result of this. And then there is also possible abuse of fundamental rights of people. And a lot of that will be looked at within the context of the legal framework. The fifth effect is the fact that it has exacerbated the problem of girl child education. Prior to now, Nigeria has over 10 million or 13 million, like we sometimes like to say, children that are out of school. Now children are not going to school. After COVID-19, the chances that every child will return to school is very slim. That will further worsen our problem of out of school children. And in that population of 10 million or 13.5 million, whatever figure we choose to use, there are over 60% that are girls. And we see how that will further worsen the problem of out of school children, and especially girls not going to school. And finally is the impact on the widened inequality, social inequality, income inequality, gender inequality, educational inequality will be further worsened. I will close by looking at what the government can do. The responsibility of the government in terms of COVID-19 pandemic is hinged on section 14 subsection 2B of the Constitution, that states that the primary purpose of the government shall be the security and the welfare of the people. Now, this is the time for government to perform that responsibility, especially of the welfare. So first, government has the responsibility of disseminating information, which we have been seeing. Government also has the responsibility to provide medical support, also provide palliative measures, and provide it adequately. Mr. Latunji Oyeyipo said earlier that some of this support that are being provided are not getting to the right people. So it must be done effectively so it gets to the right people. And then government must also direct state policies just to cushion the effect of this pandemic. And that we have seen, like the suggestion given by Mr. Oyeyipo, as per, for instance, having a policy that mandates banks to maybe provide interest-free loan or some other financial support. And also, government must ensure that human rights are protected at this time. Each arm of government also has specific responsibility. The executive arm, for instance, law enforcement, the legislative arm coming up with bills, the judiciary ensuring that cases that are brought to them as a result of COVID-19 are expedited and concluded. What CSOs can do is literally to support the government. And finally, what the vulnerable people in the society can do is to make sure that they adhere to instructions, access the support that are being provided, and they can go to places, authorities they can reach out to. They can go to their state government or their local government. CSOs are also authorities they can reach out to. Religious places are also places they can reach out to get the needed support. Thank you.